السلام عليكم ورحمة الله وبركاته. أهلا بالجميع. كنت تسمعوا لي؟ تحياتي للجميع. This is the Abed Baidas. I'm going to be your trainer for today. We're going to be addressing important discussions in terms of the health of the healthcare in the Arab world. I just want to make sure that everybody is able to hear. Do you hear me? If anybody is not hearing me, please say so in the chat area. It's going to be on your left-hand side. It says chats. So everybody can hear me? Great. I'm assuming that everybody is able to hear. Okay, great. I've got Beha said yes, so I'm assuming everybody else is hearing us. This conversation, it's going to be... Hi, Abdullah. I am glad that you are with us again. We've got a few guests from out of the country, out of the UAE, from Jordan, I believe. One out of India, and the rest we will start introducing them as we finish. This session is going to be a presentation and a discussion. I like to carry on a dialogue that rather than just one-man talk show. I'm going to ask questions, so feel free to comment on those questions, to answer those questions, or make any other comments. Think of it, this is like a virtual cafe that we are sitting together. Everybody is holding their cup of coffee, or tea, or cappuccino, or espresso, whatever, and we are having a fun conversation to talk about it. Now, why this is important, because the healthcare in the Arab world is not only limited to what everybody is thinking about. But before we get started, let me introduce ourselves, who we are. Identity Branding Forum. We are a multicultural organization. We tend to believe ourselves to be inspired by humanity. We started in 2007. We have been making a lot of headways in research and development to develop innovative solutions worldwide, and especially in the Arab world. We started Identity Branding Forum as a provider of services and training to become today a global gateway of opportunities through our own sustainable human development protocol. Now, let's start with a few bases. That's going to be the basics for the discussions of questions that we're going to have a little later on. Anybody can hear me? Anybody having a problem with sound, listening? Is anybody having a problem hearing me? Yes, okay, super. Okay, so now what I want to start with some of the basics that we really need to understand for the discussions or the questions that we're going to be addressing a little bit afterwards. Abdullah is saying, he cannot see it. Could you check your system, Abdullah? And excuse us for here 1 second. One of our friends is having difficulty to hear us, but so now The basics. Now, what people know, you need to understand what people know and feel about your business is what matters, because that is the basis of their attitude towards you, whether they like you or not. The attitude and emotion associated with people's towards your business is what make up your brand equity. How much they trust you, how much they like you, how much they appreciate the things that you do, how involved you are with them is actually the basis of what makes them love you or not, trust you or not. Now, why this is critically important, because when we move towards the brand, think of it, it's a human being. Exactly, it's something that it feels, it's compassionate. All brands are born equal. The trick is to prove one isn't. What would make you different from the rest for people to appreciate you? Is it because of the quality of services that you provide, the quality of professionals that your institutions have, the quality of services that you provide, or this is something more? For example, nobody would actually know the difference between one good doctor to another. They're all the same. To different people, to different cultures, to different geographies. What makes a difference is how good that doctor makes that patient feels. It is not how professional is that doctor is, but it's how good that he makes that patient feels about it, how comfortable that patient feels, how comfortable. Think of it as a business. How comfortable it makes me feel. What makes me trust you? Is it because you are in love with my pockets, or you're in love with my well-being, with my welfare, with my prosperity, with my culture? Branding is the art of science, is the art and science, I'm sorry, of identifying and fulfilling a human physical and emotional needs to capturing attention, imagination, and emotion long enough to make money from it. Now, that's what I said. When you claim as an institution, whether you're a hospital or a business, you are the best there is in the world because you have the best of doctors, you have the best of professionals, you have the best of management, you have the best of equipment, you have the best of everything. Trust me, your competition makes the same claim. Trust me, your patient or your clients wouldn't even know the difference. I wouldn't even know what a modern medical or physical or equipment is from another. All what I care about is the type of services, how that's going to make me feel better. Now, is it going to make me just feel better about what you do for me, or is it going to make me feel better about myself? And this is what we're going to be addressing a little bit down the line. Also, like a person, a brand has a name, a personality, a character, growth, channel, and a reputation. Like a person, you can respect, like, and even love a brand. You can think of it as a plan for decades, as a deep personal friend, or merely an acquaintance. Now, does your brand or your business stop at providing the service to the customer, or it goes beyond? Does it get started before the customer walks into your place, or it starts only when that person walks into your place? Well, how far are you willing to go as a business to make those people trust you, to make your client trust you? Are you willing to go as far as going into their homes, living their needs, living their aspirations, addressing some of the things that they care about, so when they need you, they know I have a trusted friend that I would go to. Also, like a person, a brand must mature and change its product over time, but its character and core beliefs shouldn't change. Neither should its fundamental personality and outlook on life. And that's critical. I could change the color of my suit. I could change the color of the type of shirts or T-shirts that I'm wearing. How the things, instead of exercising once a year, now I'm gonna start exercising once a week, or almost on a daily basis, with my neighbors, with my neighborhood. with my colleagues. So I'm building up a relationship of a lifestyle between them, because a brand, after all, no matter what it is you look like, whether it's a hospital, whether it's a business or an individual basis, it's a lifestyle. It's about what appeal that's going to be accepted by others compassionately. Now, products and services are the blood of a brand. They're the blood of your business. But your organizational cultures and standards for action are the heartbeat. Think of it as a heart and blood. Now, that heart is what drives emotion, what drives actions, what drives energy, what actually moves your products and services and makes it meaningful to the rest of your organs. Now, think of it as you are being the heart of your customers. You are being the heart of your clients, your patients, or the people that you mostly care about. How are you going to be able to drive their energy up? How are you going to pump them up? Are you going to do it only when they need you? Or are you going to do it just because you want to show them you care, whether they needed you or not? That's a difference. Now, what makes a difference also, to understand what makes up your brand identity, the value. Who are you is a strategic questions before you start telling me you are a hospital or you're a business. Who are you? Who cares? And why should I care? Now, remember, I'm using the word care. Why should I care about to deal with you? Why should I care about coming to you when I need help? Do I come to you only when I need help, or do I find you at all times, whether I need help or not? But you are there as my friend. You are there as my compassionate, loyal community associates, neighbors. I could be a doctor in a hospital, but also I'm the neighbor of every client, every human being within the community, not necessarily being a patient of mine. Think of it, how deep that goes. Now, how to make people love you. Good brands make people feel good about you. Great brands makes people feel good about themselves. Critical. Most people think that people within because I'm giving them a good service, they feel good about me. Great, true, they do. That's important. That's critical. But that's what you do for living. That's what you do for making money. You see, that's yours. But when you think of how you're going to make me feel good about myself, it goes far further than just the service that you'll be providing. And we're going to see that in a minute. Now, what's critical for you to know what makes people feel good about themselves, give them a voice. Hear them out. When they start talking, you'll start finding how to impact the direction of development of future businesses and the sustainability landscape. How to help your business lead change and develop a future trends, because that comes from people's ideas, people's needs, people's desires, people's aspirations. You start actually seeing the future, where it's going, rather than being led by what happens, what's brought to you. Now you start actually seeing what could happen and to lead others to. Now this will enable you to translate all talk to immediate action on the ground. But with this, when you start giving people a voice and you're listening to them, now they are a part of your future, just like you are a part of theirs. It's all about people, the people that within your community. Don't think of it, it's all about them, the people that are my clients. Think of it, everybody is your community, whether they are your clients or not. Because remember, who is not your client today might very well be tomorrow if you are a part of their life. Because you're gonna be a part of their ambition, you're gonna be a part of their drive. And the minute they need you, guess where they're gonna drive to? To you. Now, let's start with a question. Is healthcare industry only limited to hospitals, clinics, and doctors, or there is more to it? You see, most people, when you say healthcare, the first thing we think about, that's medical care, that's hospitals, clinics, pharmaceuticals. It actually goes beyond that. Healthcare, if you think about it, a family is part of the healthcare industry. A business is part of the healthcare industry. Food is part of the healthcare industry. I see healthcare as two parts. One, to really help me live healthy lifestyle, healthy life sets, as a mindset, healthy relationships, healthy partnerships. Isn't that part of healthcare? Just as like I'm looking at the healthcare component that is part of the medical care, to take care of people, cure them when they need me. But did we think of getting involved with people to keep them healthy at business, to keep them healthy at home, to think healthy, to live a healthy lifestyle, to live a healthy relationships? How involved are we in those aspirations, on those what we call passion points, or we keep that out of the door and we only focus when they need us? Because when they need us, they come for urgency, but they may last, they may not last. When they come for urgency, the alternatives are there. Then would you want to be an alternative, or you want to be the alternative? That's a question. What role do you think the healthcare industry should play in the community? Let's think of a hospital. Is the role to be only to provide the medical care they need when they need us? Or do we actually be a part of developing a healthy culture, a healthy lifestyle, a healthy attitude, engage them in daily activities? So now, instead of me with my medical staff or my business staff are sitting behind desk waiting for people to walk in, now I'm walking out with them every day. Now remember, when friends are companions, they do things because they enjoy it. They love doing things because they are having fun. When was it the last time did you think of making your relationship or turning your relationships with your people to a fun relationship? It shouldn't start at your place of work or at your place of urgency. It should start out when everybody is comfortable and going. Now, let's talk about some of those passion points that are urgently critical for people. This diagram we developed because it defines actually two things: tangible basics and intangible basics. Now, these basics actually helps us to see where are some of those passion points to be focused on for us as institutions. If you're talking about the tangible basics, we see food, clothes, housing, health, education, transportation. Now, this is the necessities for everybody to exist. Agree? And the intangible basics, we have what we call the interests, ambition, skills, talents, relationships, partnerships, facilities for me to enjoy. Now, if you think about it, the tangible, the box, the blue box, that actually what makes people feel good about you. I'm hungry, you're giving me food. I am homeless, you're giving me a home. I need clothes, you're giving me clothes. I am sick, you are treating me. I need education, you're educating me. I need a transportation, you're giving me the ride. That's what makes me feel good about you. What makes me feel good about myself, and when you start helping me to go further, to become independent, that you are a part of my aspirations. I see a future that someone also is sharing me that vision, helping me realize that visions, helping me to develop skills, helping me to develop my interest, define my ambition, build talents, relationships. Who says hospitals are only for sick people? They could also be a place where communities could come in and engage in a dialogue, developing healthy dialogues among people. That's what we call is critical for them to live. Now I feel important. I feel I exist. And these opportunities on both sides, the blue and the yellow, actually that helps businesses, whether it's hospitals or businesses, stay connected to people. And that's what keeps recycling and engaging the opportunities that we're creating. Now, let's ask another question. What are the challenges the industries is facing today on a local level, on a regional level, on an international level? I cannot go too deep into the details and the discussions of it. We're just going to touch some points out. But some of the major challenges that I see the industry is facing is a lack of data, lack of human analytics. We don't really know what is out there in our local communities. We only think the needs is basically only when they get sick, if it's a hospital, or only when they want to buy food, they go to the supermarket. But how do you foresee the future? Well, think of Nokia. Nokia didn't perceive the future when they thought everybody needed their old digital phones. They did not see a need in the market for Android, that now Nokia went bankrupt because of it and is actually using it. Now, that's what we really, how do we understand what is the changes, the challenges, especially with the growing competition in the region, on a local level to begin with, on a regional level, and on an international level. We lack data. We don't really know what's out there, and we don't really know what's needed. But if we go back to the previous diagram, this one, we will have a better data analytics to help us get to overcome the challenges of the industry. Another side of the I see my view as a major challenge is we lack localized research and development. We always rely on everything that comes from the outside. Now, I could be wrong. Of course, I'm not perfect, but this is why we're having this session or this seminar, is to have a discussion, a dialogue, to understand a little bit more of what is in the mindset of the industries, people out there, whether on a regional, local, or international level. Now, the other thing, what we really need to do, what are the local industries' competitive advantages on a local, regional level, and international level? Well, I see there is a great value for us to keep people in the local market. For example, we have shared culture. We have shared religion. We have shared traditions. We have shared history. How much are we taking consideration of these variables into perspective in the development of the relationships with the people we are dealing with on a day-to-day basis, or the people in our community, the people who are surrounding us, the people that we are hoping one day they're gonna come our way, they're gonna drive to our way. Now, who do you see the stakeholders of your industry? How could those stakeholders impact your industry to help it prosper and grow? Now, when you think of the stakeholders of your industry, let's take a hospital, for example. Is it the pharmaceutical companies, the medical labs only, government regulators, bankers, or we see it more than that? We see it as perhaps universities, educational institutions, schools, NGOs, families. Make sense? Hotels. Make sense? transportation companies, airlines, retails, mall. How could all of those be able to come? We are able to bring them together to impact our industries and help us prosper and grow. That's a critical strategic question. If we are able to answer it, we will be able to see the better way of where we should be going tomorrow. Now, times are changing, and so does the industry worldwide. True. Do you think the industry in the Arab world is doing enough to compete on a local, regional, and international level? If not, what should the industry do to compete? To start addressing this question, I think I have to we have to be honest with ourselves to say that the biggest challenge the industry is facing is its image. When somebody, for example, talk about medical care or a hospital, the first thing we see is a slaughterhouse, somewhere where people's gonna go get slaughtered. They're dead anyway, whether financially or physically, once they get into a hospital. Now that somebody could tell me this is actually a cruel statement, but how far is from the truth is it? That's critical to understand and answer. So what we should do to compete, we should actually be more focused on, rather than providing service, we should be more focused on building value. What's the added value for people to enjoy life, to live a happy life, to have a fun relationship with me? When I think of a hospital, I think of a friend. When I think of an emergency room, I think of somebody that was there by my side before I got sick or before I needed help to walk in. If you think of a bank, same things applies. If you think of a business, same applies. So when we talk about how healthy is the healthcare as a universal statement, and I'm not focused only on medical care, hospitals, clinics. I'm thinking in terms of the general definition of healthcare, how healthy it is in the Arab world. I think we are far away from it, and that's why we have that presents an opportunities for businesses. It presents a huge opportunities. How do we actually drive our people to be more engaged with their healthy lifestyle? To be for the business owners or the business decision makers or the managements or the staff is actually engaged in their communities in healthy activities, in healthy food eating habits, the developments of the cultures. It's all critical, but the more I think about it, the more of the opportunities and we're able to see. How can we actually see those opportunities? That's a strategic question associated. How far we want to go to compete on a local, regional, or international level? Do you want to compete as a hospital, or do you want to compete as a member of the community, or do you want to compete as a business, a university, a bank, or do you want to compete as a member of the community where everybody surrounds you, with everybody is holding you up, with everybody is your ally when you need them, especially in tough times? What do you think you need to the most today to compete, become profitable, and sustainable? The biggest thing I always reiterate and say, the first things that we really need to do today is to change our mindsets, the way we think. Sometimes, a couple of months ago, a friend of mine and I have been having a conversation. He says, one of our programs, IPEN Club, he says, how could that benefit me in times of an emergency? I said, think of it, a bleeding person walking into the emergency room. What is the first thing they do? He says they stop his or her bleeding. I said, exactly, this is what we do. When the first thing when you have a business emergency, is we actually remove your mind, put it aside, and replace it with a complete different system to think right, to think neutral. We don't tell people to think out of the box. We tell them throw the box away. Go to the basics. Think of the way before the current modern systems became to existence. Think of the ways that were 50, 60, 100 years ago. How close people were at that time. Doctors were actually friends of the families. There were no separations of relationships. Everybody knew everybody. Everybody was comfortable with everybody. Everybody trusted everybody. When anybody needed help, he or she didn't find one person to help. He found the whole surrounding is there to help. That's really critical way to change our ways of thinking. Now, in less than 5 words, for the people participating, joining us today, can you think of what is your brand value in less than 5 words, based on what we in the brief discussion we just had? Can we have a minute and give everybody a chance to post in the chat section on your left side? How do you see? How do you define your brand value in less than 5 words? 1 minute starts now. Anybody want to give it a chance, a try? Okay. I guess you're more than welcome to share it through email, and I will be more than happy to respond back to whatever statements. Now, this brings us to a conclusion in terms of the activities that we just the issues of how healthy is the healthcare in the Arab world is today. In that session, also, I want to bring up another point of interest of for you guys. On the October 21st through the 23rd, we are actually having a workshop in partnership with Mina College and Dubai Ambulance. It's called How to Build a Powerful Healthcare Brand in Changing Times. Now, you can see in the slide, the benefits of this is actually to help you discover how the narrow understanding of healthcare has limited business opportunities in the Arab world, and the bigger value of healthcare on every public and private entity, and how it may impact your business and boost its overall performance and stakeholders' loyalty, and the different choices to iconic healthcare branding. This is not only for hospitals or medical institutions, this is also for businesses. Because every business, to become an iconic brand, it has to have a focus point. And this is one critical area of a major interest to every member of society, whether it's an employee of a business or a member of the community. We also are offering a special bonus. Now when you have 2 to 3 people registering, you receive 15%. Registration of 4 people or plus, you get for 25% discount. But you also have something, another value basically, is to develop a case study around your own institution, which basically saves you thousands in money-wise, in dollars, and time to develop it within that framework, to have those alternatives that you can come up with it. Now, when an organization registers 5 people or more for the scheduled workshop, the organization will also receive a 1-year IPEN Club enterprise membership. It's $20,000 value. We're doing this an advantage because we just launched proudly with that IPEN Club, and it's the information, you will see it on our website. You'll see the address right now in a minute. We are also giving 50% scholarship, not combined with any other offers. For businesses, we are giving 15 seat, as you can see here, on a first come first served basis, to enjoy that scholarship. And for universities and colleges, for students and faculties who are interested to join this disruptive learning project experience, it's available to them. If you are, if you also consider sponsoring students, faculties from schools that you highly respect, then you have that opportunity, which is a unique opportunity for you. The cost of that workshop is basically is $2,000 per person, but we also have a special is a deal structured for people coming from out of the UAE to participate. That includes a hotel stay of 3 to 4 nights, and whatever other arrangements that necessary to make it happen. So we're more than happy to accommodate your needs and to win you on our side. Now, what I would like to do, this is basically the information to join the workshop. Visit our website, ipenclub.com. Please write it down. Write down also the information, the email address that you can correspond to, or call the hotline for it. And this is also good for WhatsApp as well. And we'll be more than happy to call you back and answer any of your questions. Now, I would be more than happy at this point to stop and take any questions, any comments that you have. I'm all ears to you guys. Please let me know. Yeah, you can write your questions on the questions area, and I can be able to respond to you immediately. So feel free to ask whatever questions that you may have. In the questions, and that's, you'll find it on your left-hand side. Okay, I've got Abdullah wants to speak. I gave him permission to speak. Please go ahead, Abdullah. Can you hear me? Abdullah, can you hear me? I guess he cannot hear me. Anybody has a question, please? Okay, I guess if there are no questions at this point, thank you for joining us. As soon as we hang up with this session, you will get an email asking what you think of it. Please respond to us and let us know exactly what other areas of help and give you. Visit our website for full information in some of the things that we mentioned and some of the other stuff that you might find of interest to be of help to you. Thank you for joining us today, and we really appreciate the time you've taken for this, what we call our virtual cafe. We hope you enjoyed it. We did. Thank you. God bless. بالتوفيق رب العالمين إن شاء الله. السلام عليكم.